think it would be really important that everybody recognize that without this expansion, we're just basically holding the status quo.
You could say Dr. Josh Foley has a good idea about healthcare in Canada. He has worked in hospitals from coast to coast. The cancer specialist now finds himself within the brick walls of Medicine Hat's Regional Hospital. He has an inside view of a facility that has not had a large-scale upgrade since 1985. 25 long years, he says, has the building showing its age.
We're so short of space here in the cancer clinic that if we have a visiting consultant come down for a clinic, I have to take a day off because we just don't have the staff nor the space to facilitate seeing the regular stream of patients.
Emergencies are everyday business at the hospital, and staff say while space is at a premium, they are coping and delivering a high level of patient care. While conditions worsen, those inside wonder if their state of emergency is being heard in Edmonton. More than a year ago, the health minister, who now occupies the energy portfolio, descended on Medicine Hat's Regional Hospital.
This project is going ahead. It is not in this 3-year capital plan. There are dollars for planning. But if there is some way that things change over the next couple of years, that we want to ensure that the plans are in place, so that if we're able to move forward with capital for a project like this, that we can do so, that the plans are ready to go.
1 year later, and just days away from a new 3-year health capital plan, little has changed. Health Minister Jean Swazdeski toured the hospital much like Minister Leipert did, and delivered the same answers concerning increased patient volumes and little attention from Edmonton.
There's a lot of priorities that we have to look at, and it's very unfortunate that we got hit by the single largest global economic downturn in the history of the province, and we're not the only ones suffering through it. So some projects had to be deferred and others delayed and so on. But I'm acutely aware of what the needs are throughout the province, including the needs here in Medicine Hat.
Those behind the knife and on the front lines of care have little time to think about expansion plans, as the sick and wounded care little about 3-year budgets. However, some in the community are making their voices heard, questioning why a project promised to the city before an election may again fall on the provincial chopping block.
It's a little bit stunning that they can say they're very aware. Does it mean that they're aware and they just are ignoring everybody, the people of Medicine Hat?
On his visit last week, Minister Swazdeski would not give a clear indication if our city's 325-bed facility would be getting the almost $300 million it had been promised, leaving a community accustomed to being forgotten in Edmonton again waiting to see if dollars will flow our way. Scott Cunningham, Chat News.